My name's Neil Barber. I'm a consultant urological surgeon and based in London and Surrey. And I've been a consultant for over 20 years now, and throughout my career, I've been particularly interested in bothersome lower tract symptoms relating to benign prostate disease, often known as BPH, benign prostatic hyperplasia, or BPE, benign prostatic enlargement. This 20 years has seen a great deal of change in this area. This is a really significant condition affecting really most men over the age of 60, with symptoms commonly being that of a poor urinary stream, getting up at night to pass urine, passing urine too frequently, or with urgency being unable to hold on. They can also present with issues regarding urinary tract infections and bladder stones very rarely. Some people may see blood in the urine. The first thing often when evaluating men with these symptoms is to exclude prostate cancer, but this is relatively rare in comparison, and the impact that these symptoms can have on men's quality of life can really be quite significant. The paradigm over the last 20 years has slowly started to shift, and it's been a great deal of my pleasure to be involved in many trials of new technologies looking to improve and widen the options for patients over that period of time. Initially, one usually talks about the role of medication to try and help, moving then on to surgery should the medication not be tolerated, not help, or simply the benefits wear off over time. However, over the last 20 years, we've seen an introduction of other surgical options, particularly the so-called minimally invasive surgical treatments of UroLift, Rezum and emptied. And I was very honoured to be part of some of the early trials into these new technologies and all the subsequent publications. More than that, I've also helped work with NICE to introduce them to the NHS. Those surgical options, the minimally invasive surgical treatments, the MISTs, have a benefit compared to the alternative approaches of a much lower risk of affecting sexual function. And it's become clear over the decades that this is increasingly important to men who present with bother from their waterworks. Those procedures do, however, trade off that protection of sexual function against a degree of efficacy and predictability of outcome, as well as longevity. That means there remains a place for the standard surgical approaches where you remove tissues, create a wide cavity through the prostate, and they will achieve predictably the biggest improvement in flow with the most long-lasting effects, but do start to introduce the risk of impact upon sexual function, particularly in terms of developing dry ejaculation. Even in this field, we've seen an improvement in technology. The simple TURP has improved in terms of the physics involved with electricity used. Lasers have come along, both vaporizing tissue and cutting tissue to enucleate to create a wide cavity of the prostate. And most recently, we've seen the arrival of Aquablation of the prostate, previously using the Aquabeam system, but now using the Hydros platform. And again, I was lucky enough to be the receiver of the first Hydros platform out of the United States at the London Clinic, and the second one at the Cromwell Hospital. This procedure has been revolutionary in the sense that rather than being a procedure guided by vision, it is guided by ultrasound imaging, i.e. You're looking from the prostate from the outside in terms of anatomy rather than the inside. Then using software, you can plan what aspects of the prostate you want to treat on that ultrasound image. And then rather than using any form of heat, you're using a high pressure water jet to remove and ablate tissue to create a wide cavity. This has been shown to achieve the same kind of improvements in waterwork symptoms as the standard TURP or even the lasers, but with a much lower risk of affecting sexual function. So to summarise, in 2026, we see a raft and ever-expanding range of options for men, hopefully enabling those who have been involved and understand the differences between the procedures to tailor the approach most suitable for that man in managing their bothersome urinary tract symptoms.